Hello, I'm Nancy Rowe from Rush University Medical Center and the current editor of CLD, Clinical Liver Disease, which is the AASLD multimedia journal. Today, I'm joined by Sanjaya Satapathy from North Shore University Medical Center in New York. Thank you so much for joining us. I understand that we've asked you to write an excellent review about racial disparities or disparities in non-alcoholic fatty liver disease. So what interested you in this topic, and who did you elicit to help you?
So, first of all, thank you for inviting us to write this excellent article on this. And this was so important because when I was in Memphis, for the last 10 years, I was working over there. The 40% of the population in Memphis are African Americans. So we see a large number of NAFL patients, but I was intrigued by the fact that there is a very small prevalence of NAFL in African Americans. So we were doing a study at the same time when this opportunity came. I said, let me review the whole literature. And I was thankful that I had an excellent trainee who worked with me. And he was a Emerging Liver Scholar Award winner. And so we worked together, and he put out an excellent article with this.
Wonderful. And so how did you get him to be interested in this? Is it simply just the racial disparities that you see in the institution that you were at?
Well, there is always a role of a mentor and a mentee. So when my interest was on in NAFL in NAS, and so he was interested in gastroenterology fellowship at that time, and so he was interested to work with me. So I thought this would be the best opportunity to mentor someone who's interested in GI fellowship, and that's how he started getting interested. In fact, thankfully, he got a GI fellowship as well, and this work also helped him to get through this.
Perfect. Well, disparities is a big word. So I know that we started this by talking a little bit about racial disparities, but in your review and in your own experience, are you finding that disparities go well beyond just racial? Is there gender or other things that impact this?
Of course, racial disparity is one thing. The racial disparity is not just impacting we're not just talking about the prevalence of NAFL here. There is disparity in gender, there is disparity in their outcomes based on races and gender as well. And recently, there is a paper that came out that has shown that the leading indication for liver transplantation is in women is becoming NAS now. Actually, the #1 indication for liver transplant in women in NAS patients, although NAS is the second leading indication for liver transplant in general.
Right, which is, I think, that a huge frame shift for where we always imagined viral hepatitis, and maybe some of the models of care don't necessarily work as well in this newer population. When you started by saying that although the African American community is very much enriched in risk factors for fatty liver disease, they may not have as much NASH, but it's a little bit more than just racial. So in the patients with NASH that are Black, do you find that they have equal access or equal outcomes to the?
So that's a very interesting question you raised. So NAFL is associated with multiple things. One, the metabolic traits, and second, their socioeconomic status and genetic factors. So all these factors, there is a disparity. In African Americans and whites, there is, if you look at it, there is similar metabolic trait factors. In fact, maybe African Americans has higher prevalence of diabetes, higher prevalence of all these metabolic traits. But despite that, they have a very low prevalence of NAS disease itself. In fact, advanced fibrosis is very low in those populations. And we don't know much about it, but what we understand is that there is a genetic predisposition for it. We know for the fact that PNPLA3, which is an allele, has been found to have a very low prevalence in African Americans as compared to Hispanics, which is the highest risk of developing NAFL and NAS.
So I know that genetic profiling is not something that's integrated into most of our current care models, but when you're looking at a patient that's African American or Black and that develops NASH, do you do more investigation to see if they might have a different genetic, like if there's a grandparent that was white or Hispanic, or if their risk factors might be different than what we just feel their assigned race is?
Yes, that is true. And there are some studies actually have looked into the family what is the risk of developing, or what are the prevalence of NAFL in the family? About 25% of in the families have a NAFL predisposition. So certainly there are more to it, and we don't know much about it at this point. I think certainly more work needs to be done. Precision medicine is coming. I think when the new drugs will be coming in the future, which is so many clinical trials are going on right now. I think we'll also have to look into these races, because the same drug may work in one race and may not work in another race, or maybe may work inadequately or suboptimally. And these are things that we need to look forward to when we develop new medications in the future.
So that's an incredibly important point, that you cannot test something in a population and then generalize it beyond that. Do you think that this will also bleed into ultimately our screening recommendations? I think right now there isn't a lot of emphasis on screening for something that we may not have a good therapeutic option for, but that's got to change once we have a lot more clinical pathways for these patients.
I absolutely do think, because there is genetic traits like PNPLA3 has been linked to advanced fibrosis. So when you are talking about starting a medication on someone may progress in 10 years or 15 years, and someone may progress in 3 to 5 years. They are the most important persons who will need a medications to begin with. So identifying these kind of genetic traits in future will help to strategize and start treatment early on in those group of patients.
Well, thank you so much. Do you have any closing remarks you want to leave our listeners with?
I would recommend that read this excellent review. We have summarized all the racial disparities in this article, and I would welcome that. You have done an excellent job in clinical liver disease in putting out such nice reviews. Thank you very much for the opportunity.
Well, thank you.